Well, so what I'm going to talk about is actually our studies on measles in St. Louis 50 years ago, and that Ralph Weigand and I did, and others. Next slide, please. And this is the one of the two papers that I'll be discussing. And what we described was that measles had been somewhat eradicated, and then it came back in a resurgence in 1971. And we were able to describe the rates of encephalitis and rates of pneumonia and death. And then we did sophisticated serologic studies at the time. And next slide. And that's in the companion paper. And we looked, and for the first time, using methods at that time, we were able to study IgM and IgG antibody responses. Next slide. And for the first time, we described secondary measles vaccine failure. And we presented laboratory evidence supporting this using very sophisticated techniques at the time compared to what we would do today. Next slide. Now, measles, once you've had measles, you have lifelong immunity. And Peter Panam, who was a Danish medical student who they shipped off to the Faroe Islands, and this is actually before the germ theory was really recognized. But he made some interesting observation. But the most important was that there was a measles epidemic then, but the people who had been in the previous epidemic 65 years earlier were protected. And so this is the evidence for lifelong immunity. Next slide. So measles vaccines, this is in the sequence in the US, and the same was true in slightly different timelines in Europe. Next slide. And so since the antibody pattern following measles vaccine was found to plateau in a manner similar to natural infection, it was assumed that immunity following vaccine would be lifelong. Next slide. And if this is a slide from Krugman, from Saul Krugman, and if you look up at the top, these two, one is measles, and this is with the original Edmondson B measles vaccine. But then if you look down here with further attenuated vaccine, 5 years out, you're 4 logs to the base 2 lower. And so this suggests that that protection with further attenuated vaccines wouldn't be lifelong. Next slide, please. And so in St. Louis, we described that it would be necessary for a 2-dose vaccination schedule. And the data supporting that, which is actually wrong in retrospect, because this wasn't based on serologic evidence or anything, that the pre-vaccine era is wrong. And of course, the failure rate we estimated 10%, which is what it was then, but not today. And so the next slide. And so here you see this is from my book, and that we know by age 18, 99% in the pre-vaccine era had measles. But nevertheless, if you vaccinated 95% of the population and had a 5% failure rate, you would introduce that with herd immunity, you would eventually start getting cases in adults. Next slide, please. Now, to get the two-dose recommendation, it took 18 years and two epidemics to get this recommendation approved. And it's taken a lot longer, and it took a lot longer in several countries in Europe. Next slide. Now, looking at secondary measles, this is a paper by Matt Zahn and myself using California Department of Public Health data. And if the two-dose failures you can assume are virtually all secondary failures, and they are much less ill than patients who have primary measles. And as far as cough and coryza, conjunctivitis, fever, and hospitalizations. Next slide. So now just to switch over to measles in Europe, and I have just the data from 15 to 19, and there were 58,000 cases of measles, and there were roughly 58 deaths and 58 cases of encephalitis. And from our studies of SSPE in California, we would project that there'd be 58 cases of subacute sclerosing panencephalitis. And the important thing is all of these would have and are still having post-measles immune amnesia. And so that leads to increased hospitalizations for other infectious diseases for a period of up to 5 years. Next slide. So again, in looking at this, about half the cases were in adults, which is what we saw much earlier in the US. And questions are how many were unvaccinated, how many were primary failures, and how many are secondary failures. I think those are things that are unanswered. Next slide. And in the year 2000, the WHO estimated that there were around 2 million cases of measles in Europe, in the European region. And so when you figure after that, there would be some 2,000 cases of SSPE. And the question is to the audience is, how many of you have seen a case of SSPE? And these cases are routinely misdiagnosed by neurologists. So unless pathology is done, they get CSF antibody studies are done. They're not diagnosed. Next slide. So just a summary and conclusions. Measles is bad. It's a vaccine preventable disease. It's endemic and endemic in much of the world, and in particular in Europe. Next slide, final slide. And this is the walled city of Rothenburg in Germany at the time of a feast. Thank you.